So as a part of the series that we are providing for the preconception care, the topic that I'm going to talk about now is exercise in pregnancy. Of course, exercise needs to start prior to falling pregnant and also needs to be continued during pregnancy, provided there is no medical contraindications or there is no issues with your pregnancy. So always check with your healthcare provider what can be done and what can't be done. But please don't stop exercising just because you're pregnant. That's a common thing that I get asked in everyday practice. Can I exercise? Should I exercise? I am pregnant, I can't exercise. No, pregnancy is not an excuse. It's got to be done. So if you'd like more information, you can visit the website www.Athena Women's Clinic and make an appointment or speak to your own healthcare professional for further advice. So we'll just have a brief discussion of what should be done pre-conception and also have a little insight into the RANSCOG guidelines for exercise during pregnancy. So if you'd like to have a little read of that, the link will be provided down below. Please have a read through that. But as always, consult your own healthcare professional to get appropriate advice, because like I mentioned before, the advice will vary from individual to individual depending on your medical history, obstetric history, and your own fitness levels. It's never too late to start exercising, but we don't want anything too strenuous in the first part of pregnancy. During the preconception period, as mentioned before, eating healthy is really important, combined with good exercise routine. Now, the general recommendation again is about 150 minutes of moderate to intense activity. Now, what counts as moderate or intense would depend basically, if you're panting, yes. So you make sure that you keep increasing the levels of activity to which you can acclimatize, and the panting gets better and better. But if you have not done any exercise at all, I think at least start walking. And I know there's a huge round of Instagram and YouTube's advice going around that walking is actually not an exercise. But it's important that we move. Our bodies are made to move. Our ancestors went to the farm, they were constantly on the go. Unfortunately, with the change in the lifestyle, we've become more and more sedentary. So it's really important that we move and seize the opportunity in your day-to-day life to actually move. So as mentioned before, exercising is very important. We said 150 to 300 minutes per week of intense activity or moderately intense activity, combined with strength training. Now, don't do this all back to back because your muscles need to relax, you need to relax as well. And you need to perform whatever you're doing consistently. There will be days that you just don't want to get up, it's too cold, it's raining, I'm not in the mood. All those are, yes, part of life. But as long as you can just forgive yourself and pick up your pieces the next day, that's what's important. The consistency and long-term maintenance is really important. It can be boring, but unfortunately, it's got to be done for the betterment of your own health. Now, apart from the two core activities of aerobic or intense exercises and strength training, it's also important you generally be more active in your lifestyle on a day-to-day basis as well. So avoid sitting too much, being a couch potato. So try and move your body as much as you can. As you all know, we have seen the rise in high BMI or obesity. So if we want to give better life to our upcoming generation, reduce the number of diabetics that we're going to produce, this becomes really, really important. So some of the most popular modes of exercises is walking, and other things that you could do is stationary cycling. Some women may enjoy water aerobics, so all of them are quite acceptable. Do what's comfortable for you and what you're confident with. Don't have to start something new. Like we said, keep it simple, keep it boring, but keep doing. That's what's important. The common question that does get asked about water activities is that to keep that water temperature at 32 degrees Celsius so that your core temperature is maintained and it is safe for baby then. And that's the gist of what I can give you in terms of exercise in the preconception and sort of a quick overview in the pregnancy as well. And like mentioned, please have a look at the link that's provided by the Obstetrics and Gynecology College of Australia. Please have a look and read and consult your own healthcare professional or an exercise physiologist or physiotherapist if you have any injuries to modify and adjust the exercises that would suit you. So this is in addition to the nutrition and exercise. We're just going to have a brief discussion about any alcohol or drug intake. So make sure you're eating healthy, you're fit, optimizing your weight. Second thing, please avoid drugs or alcohol. It has to be zero. There is no safe limit. As much as it is difficult to let go of an addiction, if you actually witness a baby with fetal alcohol syndrome, it is not a nice thing. So somebody else is struggling for your mistake. You really don't want that for your child. So please make sure you completely stop any alcohol or drug intake prior to pregnancy, much prior. If you need help, again, please talk to your own healthcare professional, or there are many online supports that are available as well. We generally tend to manage women who are pregnant and have any alcohol or drug issues with our wonderful team at the tertiary hospital, who also help us, guide us regarding the management, and that continues throughout the pregnancy and the postnatal period. Now, the other issue that we all struggle with is our psychological health. There can be anxiety, there can be trauma, there can be depression or full-blown psychiatric disorders like bipolar or schizophrenia and things like that. So definitely all this needs to be optimized prior to falling pregnant, especially if you're on medications as well. We see a lot more women being on antidepressants these days, and it is continued throughout the pregnancy. Yes, the antidepressants are being prescribed or taken during the pregnancy where the benefit outweighs the risks. But as you know, it's best to be as natural as possible without any extra medications that you really don't need to be on, so you can have an enjoyable pregnancy and enjoy the outcomes of pregnancies as well.